To me, I feel they are appreciating, they are practicing, and they are, of course, when they give a testimony, that means something has done, you have benefited positively, has side effects. It's now like this Moxa decreases the side effects of TB drugs.
That's what we've seen. Yeah.
So that one is true.
Yeah.
Because most of them say, sister, it's like, before I started, after I started, it was like this. Before it was like this. So you find the after one is a positive attitude to them, and they feel better, and so it's like this. The side effects of the TB, one can even take for a whole long 9 months with still the joint pains, what. But anybody who comes back with TB and this Moxa, he tells you he has improved, and even some of the complaints have disappeared completely. So it is a very
If they have the Moxa as well, that they get stronger quicker.
Yeah, to me I feel when they have Moxa they get strong quicker, because we have seen these TB patients, they are progressing to normal is slow.
Yeah.
So these complaints stay there. You find somebody in 6 months, 7 months, but he's still having those minor things. But when he adds on the Moxa,
Your perspective as the in charge, would you like to see Moxa treatment continue in Kiswa?
Yeah.
Yeah.
To me, I feel it should continue.
Yeah.
Because surely those people who are on Moxa, they are giving testimonies that it has helped them, and they have really improved.
And the patients who are co-infected with HIV, they've improved. We've seen they seem to be improving as well.
Yes.
You'd agree with that?
Because not some TB patients, they are also co-infected with HIV.
Yes.
But also they improve.
Yes.
Because when they come for their TB drugs and he tells you, you see them just moving on well.
Yeah.
But the most important thing, they come and tell us this drug is working, like this drug is working.
Yeah.
So for us, we recommend those ones who feel really could continue with it, there is no problem.
Okay.
Because they are seeing the positive part of it.
I deal with the HIV and have been involved in the Moxa treatment. Report I get from my clients, they report much improvement after using that treatment.
And what sort of improvements do they report?
Pardon?
What sort of improvements do they report?
They report there are those who come who are actually very weak.
Yeah.
And they say after starting that treatment, they feel they are becoming stronger again. Because some come with people supporting them, but when they start the treatment, they can even come alone without any support.
Do you think they do better with the Moxa, with the TB drugs?
Yes, they do improve a lot.
And do you think it helps them with the side effects of the TB drugs?
Yes, it does.
And what sort of side effects do you see?
Those who come with weak limbs,
Yeah.
they cannot walk,
Yeah.
and they cannot even bend.
Yeah.
Generally, you see they are very weak, but you see them coming up after treating the treatment.
Right. And how quickly do you see the responses in the patients?
Just about 2 or 3 days.
2 or 3 days, that quick?
Yes,
and then you start to see the improvement.
Reporting some improvement.
Okay.
Continuous
Okay.
Moxa patients, they have a lot of improvement.
In what ways do they improve?
Some of them, they had no power, strength, but now they have got strength. They can walk. Some of them have got appetite. Some of them have stopped feeling chest pain. Rapid improvement with the Moxa.
With the Moxa. Much
drugs,
more.
But with drugs alone, there is a slow progress.
Okay. And another question from the patients that we've seen today is about some of the pains that they get, and which they think are associated with the drugs, so the joint pains, the leg pains. So have you seen with Moxa patients that those pains have improved? Because they're saying that they've improved, and I just want to hear
They
whether...
have improved with Moxa.
Yeah.
When they use Moxa, they feel the improvement, the backache,
Yeah.
the joint pain.
So do you think it makes the drugs easier to tolerate? Do you think
Yes.
any of the patients stop taking their drugs because of the Moxa?
According to us here, how we teach them, they don't.
Good.
They complete their regimen and continue with the Moxa.
So using Moxa with the drugs doesn't put the patients at risk if you train them properly with the drugs?
They don't put them at the
That's
risk.
good. Okay.
I am Ichumar Mer Magdalene, TB focal person, Kiswa Health Center. With Moxa, the drugs are working very, very well, actually, because mostly when I start these clients on TB treatment alone, they come complaining of joint pain, the knees, the hands. Much as they look healthy, but they complain of those pains, sometimes failing to walk. But those people, at least those ones who have, like this lady whom I brought yesterday, we put Moxa together with TB treatment, she may not experience that.
She think that the period of infection is shortened with the Moxa. So say for instance normally a patient might be infectious for 6 weeks with the drugs. Do you think that that period might shorten with the Moxa?
Exactly, because if Moxa raises up the immunity, now the drug is fighting the bacteria, the bacilli, the immunity itself is fighting the bacilli. Now instead of this bacteria finishing like for example 1 month on your body, very infectious since the time you started taking drugs, but because they are hit from both sides, so it means the period of being 1 month will reduce to probably 3 weeks, 2 weeks.
So if that's true, then the spread of the disease should slow down in the community. Seeing that the patients who we've seen in the last 2 days who are co-infected seem to be doing as well as the patients who have just got TB. Would you say that HIV patients are strengthening as well?
Indeed, because what does HIV do? HIV breaks down the immunity of the patient, and when the immunity of the patient is broken, then the patient is prone to any other disease. But now if this Moxa is there to lift up the immunity of this person, it means much as the HIV is there, but the immunity is strong enough to fight against HIV. So it may not be able to break this patient down compared to the other one who is not on Moxa.
Evidence though for the infection period
Of HIV?
Yeah, no, of TB. Do we have any evidence that it's...
The evidence you may have is this. A patient comes from day one, coughing, very much coughing so frequently, and long episodes. When he coughs, it really takes long. But maybe by the second coming, he's no longer coughing so much. That's already evidence that this patient infection is reduced. The other time was brought being held, but this time has come by him or herself. You know, those are the evidences which shows you
this is a Moxa?
It is both. It is both. When you put them both together, so fast.
Continue here.
Me, I want you to continue, and the reason is, you see this lady, there's a brown lady who was here today. You can't believe she was on TV. Those are people who are really effective in using this Moxa. There was another one actually called Adija. She's called Adija. She came the very day you came. She was here in the morning, and she stays in Ginger. And I was like, oh God, I wish you had come yesterday. But she has already gone. When you look at her, because she's also very good in using it. When you look at her, you can't believe she was having a TB. And yet Adija is both TB and HIV. But she's so healthy and so good. At the end of the day, and mostly these ones who are HIV positive and TB positive, they end up dying. Because it's like, it's not really help. There's nobody to help him, nobody to encourage him. But those without relatives, no, at least they are encouraged, because the relatives see the good which is coming out of Moxa.